Allopathic medication, part 19. Research can be influenced by biases such as publication bias, conflict of interest in academic publication. For example, studies with the conflicts due to industry funding are more likely to favor their product. It has been argued that contemporary evidence based medicine is an illusion. Since evidence based medicine has been corrupted by corporate interest, failed regulation, and commercialization of academia. Number four, systematic reviews methodologies are capable of bias and abuse in respect of the choice of inclusion criteria. They are capable of the bias and abuse in respect of number one, choice of inclusion criteria, number two, choice of outcome measures, comparisons and analysis, number three, subjectivity inevitable in risk of bias assessments, even when codified procedures and criteria are observed. An example of all these problems can be seen in Cochrane Review as analyzed by Edmund J. Fordham et al. In their relevant review. Next, a log exists between when the RCT is conducted when its results are published. An RCT is conducted, a lag exists between when the RCT is conducted and when its results are published. Next, a lag exists between when the results are published and when they are properly applied. Next, hypocognition, the absence of a simple consolidated mental framework into which new information can be placed, can hinder the application of EBM. Next, values. While patient values are considered in the original definition of EBM, the importance of value is not commonly emphasized in EBM training, a potential problem under current study. A 2018 study, why all randomized controlled trials produced biased results, assessed the 10 most cited RCTs and argued that trials face a wide range of biases and constraints, from trials only being able to study a small set of questions, amenable to randomization, and generally only being able to assess the average treatment effect of a sample, to limitations in the exploiting results to another context, among many other outlined in the study. Application of evidence in clinical settings. Despite the emphasis on the evidence based medicine, unsafe or ineffective medical practices continued to be applied because of the patient demand for tests or treatments, because of the failure to access information about the evidence, or because of the rapid pace of the change in the scientific evidence. For example, between 2003 and 2017, the evidence shifted on hundreds of medical practices, including whether hormone replacement therapy was safe, whether babies should be given certain vitamins, and whether antidepressant drugs are effective in people with Alzheimer's disease. Even when the evidence unequivocally shows that the treatment is either got safe or not effective, it may take many years for other treatments to be adopted. There are many factors that contribute to the lack of uptake or implementation of evidence based recommendations. These include lack of awareness at the individual clinicians or patients micro level, lack of institutional support at the organization level, meso level of higher at the policy macro level. In other cases, significant change can require a generation of to retire, physicians to retire or die and be replaced by physicians who were trained with more recent evidence.